It's been about 2 years since the BC government made most prescription contraception free for anyone on the provincial medical plan. It was the first jurisdiction, in fact, in Canada to do so. And in the government press release, when that policy was first introduced, it said costs will no longer be a barrier for people to make choices about their reproductive and sexual health. Well, a new report in the British Medical Journal looked into the impact of this policy. And for more, we're joined by Laura Schummers, lead author of the report and an assistant professor at UBC. Good morning to you.
Good morning.
Thank you for being with us. When we're looking at prescription birth control, just explain the two tiers if you can, because there is more than one tier when it comes to, the cost and effectiveness of various forms of birth control.
Yeah, that's absolutely right. So we generally think about contraception as either Tier 1 methods, which include long-acting reversible contraceptive devices.
Okay.
So these are either the intrauterine device or the IUD. This is the most commonly used Tier 1 method, or the newly available subdermal contraceptive implant.
Okay.
Now, these devices last for at least 3 and up to even 10 years, depending on the specific device, and are extremely effective. Less than 1% of users of these methods become pregnant during each year of use, compared with our Tier 2 methods. Mm-hmm. So these include the oral contraceptive pill, as well as the contraceptive patch, ring, or injectable contraception. And for these, the failure rates or the pregnancy rates go from 6 to 9% per year of use.
And it used to be back in the day that there were often complications that came with IUDs. Those have left us, have they, with modern technology, more modern technology?
Yes, indeed. That is a thing of the past. That's from the very early IUDs back in the 70s, and thankfully these are now very safe.
So what impact then did universal access have on the kind of birth control people were choosing?
Yeah, so what we found in BC is over the first 15 months of free contraception across the province, that there was a significant increase in use of prescription contraception overall. But this was really concentrated in those Tier 1 methods. So we saw a 49% increase in use of IUDs and contraceptive implants compared with what we expected to see.
Yeah.
And that amounted to an additional 11,400 users during that period of time. So that was really a huge policy effect.
Okay. And so what does that tell us about what impact universal birth control can have on economic outcomes, on, I guess, even educational outcomes?
Yeah, absolutely. So the first thing that tells us is that cost was a substantial barrier before prescription contraception was universally free. So even with the previous mix of private or income-based public insurance, that was not sufficient for people to choose whether to use prescription contraception and which type they wanted to use. So that's the first step. Mm-hmm. Then secondly, this means that we're better equipping our population with the tools to make their own reproductive choices and manage their family planning goals.
It's interesting. I mean, it might be on my own lack of creativity, but when I hear prescription contraception, I automatically think of the pill because I think of a prescription as, something you go renew every month.
Yeah, absolutely. And I think that, the pill has historically been the most commonly used type of contraception. Yeah. And I think what we're starting to see now is a shift because the pill, you have to take it every day. You have to renew that prescription regularly. And with these Tier 1 devices, some people would call these a set and forget method. Yeah. Because once you have that device in place, this provides effectiveness without the user needing to do anything. And that's for at least 3 and again, up to 10 years.
And so what did we find about the cost overall of this program? I guess, I'm not sure how you assess the benefits other than, how do you assess the benefits?
Yeah, good question. So first about the cost, what we know about these Tier 1 methods is that they are expensive upfront.
Yeah.
So they can cost up to $350 or $450 at the outset. But over time, over the full duration of use, they're actually quite cost effective.
Yeah.
When we compare that to something like the pill where, yes, it's cheaper per month, but you have to pay for every month of use, at least $20 up to maybe $30. So that adds up over time and actually becomes more expensive. So in terms of how we assess the effectiveness of this type of program, the first step is use. So did it change use? And that's what we've discovered now today. Yes, this made a big impact.
Right.
We can then look at things like any changes in abortion rates or pregnancy rates, sort of changes in reproductive health outcomes. And then beyond that, we actually will look at the cost effectiveness to the health system. Because yes, the provincial government is now indeed paying for this prescription contraception, but that may mean that they're paying for fewer other reproductive health outcomes, pregnancies, births, abortions, miscarriages, even complications that can go along with those, such as hysterectomies or other surgical procedures. So for that, we need a bit more time after the policy for that data to come in. But we do anticipate from all of the best available evidence, this is a cost-saving policy.
And so the BC was the first jurisdiction to do this. Are we seeing any, where are we seeing others follow?
Yeah, that's a great question. So initially we saw Manitoba follow suit, and they implemented a nearly identical policy in October of 2024. And this sparked a national conversation so that in, again, October 2024, there was a federal bill passed for a national pharmacare plan that was aiming to make contraception as well as medications to manage and treat diabetes free across the country.
Right.
But the implementation for that relies on agreements between the provincial and territorial governments and the federal government. So at the moment, there are 4 such agreements in place, and those have stalled. So our study really tells us it is essential. This should be a political priority across the country to put those agreements in place for all jurisdictions that do not yet have such agreements.
And it would be something for the provinces and the federal government to talk about when they're sitting down at the table, hammering out interprovincial trade agreements and so on.
Exactly.
It's not like there's an opportunity, like there isn't an opportunity. Your findings were published in the British Medical Journal, which tells us that there's an international interest in what BC is doing here. Will we see, how closely are people watching Canadian reproductive policy outside of Canada?
Yeah, Canada has had, over the last decade or so, has really come into the spotlight internationally in terms of being a leader in providing evidence-based and evidence-informed reproductive health care. And this is now yet another example.
All right. Laura, thank you so much for coming in. Really appreciate it.
Thanks for having me.
It's great to talk with you. That's Laura Schummers, lead author of the report on BC's universal birth control policy in the British Medical Journal, out this week. Also an assistant professor at UBC.